I want to welcome this evening Governor Ned Lamont. Governor, thanks for taking the time to talk with us.
Nice to see you, Jen.
Now, you were on a teleconference with the president and the vice president today talking about reopening the country. Are you satisfied what you heard from the administration?
I am satisfied. At one point, they were talking about giving governors directives, and this is what you've got to do by May 1st. And after some discussion, they decided to let the governors take the lead, but we'll get some guidance from the federal government in terms of, when you look at infection rates, when you look at hospitalizations, and a path to get people back to normalcy.
Now, you had said that you got called out by President Trump on that phone call. Tell us what that was about.
Well, he was talking about his, Reopen America strategy, and started talking about sports contests and what they mean to get people pumped up and how someday maybe get people back in the stands again. And then he said, how about you, Governor Lamont? What do you think? What's going on in Connecticut? So I had the opportunity to tell him about the Travelers Championship and how in late June they're going to open that up. They're going to have the championship golf tournament right here. But with no fans. It'll just be a televised event.
Now, the president has been adamant that he wants to open up the country earlier than you talked about opening up the state. He had named May 1st or earlier. You had said May 20th. Do you foresee issues? I mean, it sounds like on this phone call, and it sounds like in the last day or two, he kind of walked back and said that they're more supporting the states and the states can make decisions on when to reopen.
That's right. They're leaving that decision up to the governors. Look, I don't know what Connecticut could look like on May 20th. We're going to start extensive testing. We're going to get more of the protective gear and more of the masks. And those are the things we need to do to make up our mind what happens on May 20th.
Yeah, what are the milestones that you are looking for to reopen the state?
Testing would tell us whether the infection rate is going up or it's going down. Hospitalization tells us how much capacity we have in the hospitals. And the protective gear, if we get more masks, that would allow us to open up a lot of nail salons and barbershops and places, at least by appointment. You can start getting back to normalcy, but we're not there yet.
Now, today you introduced the Reopen Connecticut Advisory Board. You had them speak during your daily briefing. They were talking about testing, as you just said, for COVID-19, as well as immunity testing. So what is that going to look like? We have a viewer question. A lot of people writing in about this. Carrie asking, is he planning on having everyone in Connecticut tested in order to make his decision about opening up businesses? If yes, how?
Well, we're not going to be able to get everyone tested in the near term, so I can't wait for that. But I want to do enough testing, and this is what the president has recommended as well. So at least we know what the infection rates are, what areas are most at risk, and what people are most at risk. What you can do with the antibody testing is see whether perhaps you already contracted COVID. You didn't know it. You thought it was a case of the flu, and maybe you've built up antibodies so you're immune. Those are the type of answers we'll be able to get over the next month or two.
Are you going to mandate those tests? I mean, how will you? Will a restaurant worker, for example, if they want to go back to work, have to be tested to see if they've had immunity before?
A lot of people want to test. We've got the CVS drive-through test going up in New Haven, up in Stamford, where you can quickly get an electronic analysis of whether you have the symptoms that make you worthy of being tested. There's no problem with people wanting to get tested, wanting to know that they're free of COVID or at least protected from COVID.
So with this advisory board, are they going to be looking at that? I mean, I know there are some privacy concerns with some of the ideas that have been discussed. Obviously, this advisory board, was just formed and they've been together for a couple of days now. But for example, I know that one of the models that they were looking at did include using technology to track, for example, contact tracing or mass testing. Is that something that you're going to consider?
What we've got is an extraordinary group of people. Dr. Koh is one of the leading infectious disease academics in the world down at Yale University. He's put together a group of people who focus on testing and therapies and vaccines. So he's running the whole scientific piece of our team. And Indra Nooyi, who you maybe remember used to be head of Pepsi, she's got a strong relationship with the business community, big businesses and small. So we'll put together the business needs and the scientific. So from a public health and an economy point of view, we can make the right decisions.
I guess people are just looking at that and they're wondering, is it going to be mandated? How will you even know how many people have the antibodies, how many tests are actually going to be done and get people and reopen the economy? Is it going to be more on a volunteer basis? Is that what you're aiming for? Or is it
Yeah, it's on a voluntary basis, absolutely. And more importantly, right now you have to have a directive from your doctor saying you're allowed to be tested because you're showing the symptoms, you're at risk, or you're probably a first-line healthcare responder, at the hospital. You want to be tested, make sure you're safe, or you're somebody at the hospital itself and see whether you have COVID or non-COVID, and that allows us to figure out where best you can be treated.
I know you were saying today that Connecticut is a smaller state, and that while bigger states may be looking at opening regionally, Connecticut, you were saying, what happens in Hartford does affect what happens in Putnam. But there are a lot of people in, for example, Eastern Connecticut that feel like they should not be on the same timeline as Fairfield County. They do not have as many high infections of the coronavirus. What are your thoughts on reopening regionally? Will you be doing that?
We're thinking about it, but as you point out, we are a very small state. So if Willie Brew and Willimantic says, let's open because Willimantic does not have that high an infection rate, but Hartford has a higher infection rate, then all you're doing is enticing people to go from Hartford to Willie Brew and Willimantic. And what that means is the virus is being transmitted. Frankly, that's why I wanted to work with Rhode Island. I wanted to work with Massachusetts as well as New York. So we make some of these decisions alongside of each other. Otherwise, you'll just go across the border to Massachusetts to get a beer if you can't get one here.
You had mentioned protective gear before, which I know has been such a problem to get. I know your administration was talking today about how an executive order you signed allows the state to deal directly with China, and that there were a number of orders that were coming in. We're a month into this crisis, though. Is this coming too late? Were we too reliant on the federal government, even after the president had said that he felt it was the state's responsibility to get PPEs?
Look, we placed those orders months ago, but so did everybody else in countries around the world and 49 other states. So you're right. A lot of the protective gear, the masks, they landed at the tarmac ready to come up, and then they get rerouted into the black market, resold again at a big premium. Or sometimes it was FEMA, the federal government, that was buying this as well. So that was not the smartest way to organize this. The federal government probably should have been the purchasing agent. They should have represented all the states in negotiating with the Chinese manufacturers. And then they should have come back and allocated, in this case, the N95 masks in a much more deliberative way. But when that didn't happen, we decided we had to take things in our own hands. We're setting up the desanitizer in New Haven right now as we speak. And now we'll be able to cleanse about 90,000 masks a day. So we're going to greatly improve our own capacity and do it on our own.
I know you said before in press conferences that it looks like as of now there's enough PPEs for our frontline healthcare workers for the short term. But you did have nursing home workers protesting outside of the Capitol today while you were giving your daily update, and they are demanding access to PPEs. There are people who have fallen through the cracks here. What are you hearing from them, and are you trying to get and find the people who aren't being protected?
Oh, absolutely. We're on the horn every day with each and every one of the nursing homes. They can go out and get PPE themselves to protect their people, just like the hospitals are getting gowns and masks as well. The unions should be looking out for their folks as well. But I am taking the lead. I'm going to take responsibility. I'm going to scour the globe to get the gowns, get the masks, get the gloves, so that each and every one of those frontline nurses have the protection they need. I'd say overwhelmingly the nursing homes are managing their supply of gowns and masks pretty well, but some of them are falling behind, and we got to do a better job helping them out.
What's the update on the executive order about face masks?
The update is, I think it's going to probably come out tomorrow, if I'm not mistaken. What we said is, look, use your common sense. If you're walking along and nobody else in the road, there's no need to wear a face mask. But if you're coming up to a red light or there's a great group of people around, put your mask on temporarily. If you go into a grocery store, put your mask on. If you're a grocery store worker or an inside worker, you should have a mask, and your employer should provide you the mask. And if your employer can't provide you the mask, then at least wear a scarf or some other face covering. This is the way we're going to stop this virus from spreading any faster.
We got a big response online about this, especially because you're putting out an executive order, and we'll see what the language is. A lot of people wondering how you can enforce it. I want to read some comments to you. Sharon says, residents can't even find toilet paper, never mind masks. If you're going to issue an order like this, the state needs to provide a mask to every resident. Jim saying, as a small business owner, the potential executive order to require all employees to wear a mask is frightening. First, the masks are very hard to come by. How would we be able to ramp up to this order with such short notice? What do you tell them?
I would tell Jim, you want your employees to be protected as much as possible so they can continue to work without getting infected and have to quarantine for 14 days. So if you're not out there aggressively trying to get masks, at least tell them to wear a scarf, wear a bandana, some way that they can protect themselves and protect their fellow workers. That's in the best interest of, the shop that you're trying to run.
Are you going to be enforcing this? Like, will there be a fine if someone's in a grocery store and not wearing a mask?
We haven't had to do that yet. I found the people of Connecticut have really stood up. Some time ago, we had a safe store rules. We said you can't have more than a certain number of people in your store. We want people 6 feet apart as they're waiting in the cashier's line. And I'd say overwhelmingly our stores followed, that guidance that we gave them. In a few cases, they didn't, or they got sloppy. And we were notified about that, and the authorities went and spoke to the store owner and said, this can't continue. You're putting your employees at risk, and you're putting your customers at risk. And they followed our lead.
We do know that when these recommendations have been put out, there's been some confusion and needed clarification. I know you were just talking about the shopping rules. For example, you had said during a press conference that one family member should go in and shop. It had sounded like it could be interpreted that that was a rule, that was an order, but it was a recommendation from you. We know we had a mother who went to a Walmart with her son and was turned away because the store said you're not allowed to go in there with another family member. And I know people are looking at the masks and they're confused on whether it's mandated or not. I know you just talked about that, but how do you move forward with recommendations and do it in a clear and concise way so businesses and the residents of Connecticut can follow it?
One, use your common sense. Obviously, if a mother stops by a store and has a little child with them, nobody's going to say no. But my strong recommendation is only send one family member to that store. You know why? Because we want to decongest the store to keep you safer and keep the employees at that store safer. If you're, wearing a mask in a crowded area, you're right. You should do that. If you can't keep 6 foot of distance, you've got to wear that mask. If you're walking around a quiet road, use your common sense, not necessary.
I want to talk about the backlog at the Department of Labor quickly here. I do know that they were able to test some 60,000 claims last night, which went through with this new system they implemented. We know today they were going to be testing another 60,000. I want to bring up another email, Bill writing in, because there's so many people who are depending on this money and they haven't gotten it yet, and they're in crisis. Bill says, kindly ask him about unemployment benefits for self-employed people. We have been told that independent contractors will now qualify, but according to the state website, they are waiting for federal direction on the issue. We had a lot of people write in about independent contractors, for example, hairstylists who are, haven't gotten anything yet, and they're confused on whether they're going to get something. And how
Well,
long
you're
will it
right.
take?
The federal government, I think in their wisdom, because we have more and more independent contractors, you call it the gig economy, their jobs stopped, their revenue stopped. So the federal government said, let's add them to the list of folks who are eligible for unemployment compensation. Good idea. The problem is there's not one labor department in the country, including the federal labor department, that has the software in place to allow that to happen. So that's going to take us probably another week or two. Everybody will get paid. They'll get paid retroactively, which is important. But just as important for all the employees that are looking for unemployment compensation, you know, we had 20 times more apply for unemployment comp than we had in the last recession back in 08, 09, 20 times more. And we kept up with that. I got to give a big shout out to the Department of Labor. Over half those checks have gone out, or at least direct deposits. And I think the other half will all be done within a week retroactively. So it took a while, but we've done a lot better than a lot of our neighboring states. We have better to do, certainly, in terms of the independent contractors. But I want you to know the folks that are working their heart out, this thing came on very suddenly, and we're making it work.
I want to bring up another viewer question here. Seth Winkleman asks, why aren't all nurses being offered housing? Why aren't we being offered hazard pay like Massachusetts? Is that something that you would consider for these frontline workers?
Yeah, we're certainly doing that for nurses at the nursing homes. But nurses at the hospitals, they've got life insurance, $25,000 of life insurance for each and every one of them was just declared free for the next 3 years. Thanks to some generosity of some folks here in Connecticut, got daycare for those folks as needed, so they're able to keep going to work. We made sure that their health insurance is covered, so there's no out-of-pocket for any COVID-related expenses, no co-pays, no deductibles. So we're trying to do the best we can for our nurses, and they're on the front line in terms of getting the masks and the gowns as well. When we get that CVS drive-through testing facility, first responders get the first 100 tests every day.
Life insurance is great, but obviously you only collect that in a worst-case scenario. The child care also great, but in terms of hazard pay, being paid more when you're putting, you know, your health on the line, is that something Connecticut would consider?
I believe we're doing that right now for the nursing homes. Obviously, the hospitals are the one that pay the nurses at the hospitals. You know, we reimburse the nursing homes. So I think I'd have to check with the folks who run the hospitals. I did tell you, though, we are doing everything we can to make it easier for those nurses to do the job they're doing like such heroes every day. And we are providing housing for them. I think that was the other question. We've got a dormitory space. It's central, it's southern, so that they don't necessarily have to go home, and they got a safe place they can stay. They don't have to worry about the possibility of infections at home either.
Now, Governor, I got to ask, how are you doing? Because I know you've been doing these press conferences and you have a lot going on. How are you feeling?
Look, I'm feeling good. I'm feeling really good about the people doing the work in this state. You know, again, our nurses and our first responders are heroes. We're working really closely with the hospitals, who have to work closely with them. We didn't always have a great relationship with the hospitals, remember, going back a few years. Now we're working a hand in glove there. I feel really good that our commissioners are all working together tight, no more of the silos. So I appreciate the opportunity to make a difference and hopefully save some lives.
All right, well, you stay well and be healthy. Thank you so much for taking the time to do this interview tonight.
You too, Jen. Best to you and all your listeners.